Welcome to Let's Talk Micro.
Hello, my dear audience. Welcome to another episode of Let's Talk Micro. As always, I hope you had a great week. And of course, you can always find Let's Talk Micro on Apple Podcasts, Spotify, Amazon Music, Good Pods, wherever you listen to podcasts, you can find Let's Talk Micro. As far as social media, I am on Instagram, TikTok, Blue Sky Social, and YouTube as Let's Talk Micro, on X as Let's Talk Micro 1, on LinkedIn as Luis Plaza, and I have an email address which is letstalkmicro@outlook.com. So either via social media or via email, you can reach out with any feedback, any suggestions. They are always welcome and appreciated. So please go ahead and subscribe to the podcast, download episodes, and if the app allows you to do so, please go ahead and leave a review. Thank you so much for the support. As always, if you are looking to learn more about antibiotics, please check out www.learnantibiotics.com and the Learn Antibiotics book available on Amazon. These resources include cheat sheets, practice tests, games, and more, and they are being used by thousands of people worldwide and may be helpful for you or your colleagues. And these are some great resources from Dr. Timothy Gauthier, a very passionate pharmacist. And as you know, the Let's Talk Micro podcast does not have any sponsors, so if you want to support the podcast in any way, you can do so via a Venmo link or via Buy Me a Coffee, KOFI, both links available on the show notes. Okay, so I'll try to be brief because today's episode is very long, but it is great. So real quick, I'm going to tell you that if you haven't checked out the previous episode, please go ahead and do so. It was a great overview into acid-fast bacilli, or AFB. And in the episode, Dr. Felipe Cerqueira from the University of Alabama, Birmingham, he joined the podcast to talk about AFB. So he does a great overview about media, he talks about staining, and he talks about the rapid growers. So this episode makes a great overview, so I definitely invite you to check it out if you haven't already. Okay, so I am very excited about today's episode. It was a suggestion from a listener, and it was about the path to microbiology. And this community is so wonderful, and some of my listeners, they're medical lab scientists, whether they work on the bench, whether they work on the industry, or you also have listeners that are directors. So the positions are varied across the field, and you might be doing different things. So maybe you start doing one thing and then you move, right? You know that sometimes medical lab scientists, they might start on the bench and then they move to the industry, or they get a PhD and become directors. Or maybe you transition into teaching. And of course, it goes beyond being an MLS and making some changes or transition into different areas during your career. You can also, maybe from the get-go, you got a PhD and maybe you work in research, or you became a director, or you're an infectious diseases physician or an infectious diseases pharmacist. So there are many pathways, many ways that we find ourselves in microbiology. And that's what today's episode is about. And this episode is going to be part of a series. And it's just, in the episodes, I'd sit with two people, sometimes, might be three, and we talk about our careers. And of course, I have shared some things with you over the years that I have been doing the podcast. So the guests are mainly going to be sharing their careers and talking about their path, but I will definitely be talking about mine as well. So in this great episode, in this series of conversations, I'll be asking the guests things like, what led you to choose a career in microbiology? What inspired you? If you hold a different position right now from the one that you started, what led you there? They also provide suggestions on what can we do to improve, whether it's laboratory medicine or whether it's microbiology. And of course, I asked them what's their favorite bug. So to kickstart the series, I have two guests in this episode, which are Dr. Nicholas Moore, a director, and Christina Angelini, an educator. This is a great episode. I had such a great time, and I know that I say this a lot, but I do enjoy doing this. So, great episode. Let's go ahead and listen to it. So, hello everyone. So, this is a little bit of a different episode where we normally are covering a topic microbiology related, but I'm very excited. At some point in time, I have talked a little bit about my career. I have mentioned things like microbiology. I love her, but sometimes doesn't love me back. I feel like my career has gone the way of Benjamin Button and has gone backwards sometimes, and there's a lot of things. But I definitely love what I do, and meeting and connecting with people has been such a huge plus of this. So I had a suggestion for an episode, which was, talk about how do we find ourselves in microbiology, what motivated us, how do we find out about the field, how we like it, and then anything else that we can think of, how we can make it better. So with me today, I have two guests to start this series where people from the microbiology field, they come in and they talk a little bit about their careers. These two guests, I had the chance to meet them in person, and now I get the chance to record an episode with them. So with me today, I have Christina Angelini and Nicholas Moore. Nick and Christina, welcome to Let's Talk Micro.
Thank you for having us.
Yeah, thanks. I'm really happy to be here.
It is definitely my pleasure. So let's start before we dive into how we got here. I told the audience your name, so maybe let's start with a little bit about what you do and anything else that you want to share with the audience. Let's start with Christina.
As you said, my name is Christina Angelini. I am a medical laboratory educator at Radford University, which is a public state-funded university in southwestern Virginia. And we have both a post-baccalaureate degree or certificate and a bachelor's degree in MLS. And so currently I teach microbiology as well as transfusion medicine and hemostasis at the moment.
Well, welcome again. And what about you, Nick?
My name is Nick Moore. I am a medical microbiologist. I'm the associate director of the Clinical Microbiology and Molecular Infectious Disease Laboratory at Rush University Medical Center in Chicago, Illinois. And I'm also an associate professor at Rush. And I've prior to becoming a laboratory director, I was a medical laboratory scientist, worked mostly in micro, but also I had some generalist experience when I worked at my first job and getting out of MLS school, which was on an evenings shift, and been in the field really since 2009, I think. Yeah, 2009.
Welcome again. And I think sometimes, that second shift, evening shift, it tends to be sometimes, very common in people when they're starting their careers. I think that, for me, I did a little bit of, and I told this before, when I started this, there were a lot of techs, that they had been working in there for 20, 30 years. So getting into that first shift to read plates and diving into that, it was very tough. So I'm like, okay, how do I get in? And I had night shift, and then from there I started working my way down. But definitely, I've seen a lot of people start their careers and they start that evening shift. I know it's kind of like, especially you're young, it gives you like a chance to sleep in, and then you go work, and then, right? So as you get older and maybe have a family, then you start considering, okay, now day shift is a better option for me. Work during the day and then take care of the household and do things like that. Very common. So, all right. So let's start with the question, right? So we know that a very common theme when it comes to medical lab sciences, a lot of people find about this field sometimes, by accident, or they know someone that knows someone. You already have a degree, you go back to school. But then not only that, finding the field and then getting into microbiology. So I'm going to start with you again, Christina. So what inspired you to choose this field? In this case, we're all MLS. So how do we get there and then moving on from there to microbiology?
So I started in similar way to what you described. My first bachelor's degree is in biology, and the educator, who is actually now our program's program director, came to a seminar class when I was an undergraduate and talked about all that medical laboratory science could be. And I thought, wow, that's amazing. That exactly describes what I want to do. I want to have a career in healthcare, but I'm not really certain that I want to have direct patient contact. I love all my lab stuff. And so I started pursuing what I was going to do after graduation from my biology degree. And so I selected a graduate program that allowed me to complete my MLS as well as a master's degree in medical laboratory science. I think a lot of people know about microbiology because you get a lot of different flavors of microbiology as a biology major, even as like a chemistry major, other health sciences and whatnot. But so I had kind of a microbiology bent kind of going into my laboratory education. But I did find that I loved other things and other aspects of the clinical lab as well. And so my first job out of school when I graduated was actually in a core lab type setup with a reference lab. And then my husband and I relocated down here to the Roanoke Valley, and there happened to be a day shift microbiology plate reading position. That is the holy grail, right? And so my previous micro experience, I worked second shift as well while I was a student. And so I was like, yes, this is it. This is it. And so I was very fortunate when we moved down here that I was able to get into what I really wanted to do. But I also find that the skills that we learn as microbiologists really extend to other areas of the lab, like the more manual areas like blood banking. There's a lot of crossover. I feel like I know, Luis, I listened to the MicroSim episode with Emily Mathis recently, and they're combining their blood bank and their micro stuff too. So I thought that was great. So I was really happy. Micro is my first love. I started teaching as an adjunct for microbiology only. And then when I came on full time, got to show off a lot of other skills. But I'm really happy anytime I can bring microbiology into other topics. I know sometimes the students are like, if you could not, we're doing blood banking right now. Could we not talk micro right now? I'm like, no, let's talk micro. I'm ready. Like, please. They get kind of excited, maybe a little annoyed by, I'm like, let's bring micro into this. They're like, again, come on, we can talk about something else, can't we? Like, okay. So pretty traditional on my front.
Yeah, I love it, and even sometimes in because you obviously you're very passionate and you enjoy talking about it, and even finding that in even in the micro lab sometimes it's not everyone is that way, so it can be it has been challenging. At least for me sometimes, because that's what I want to do. I want to talk micro, and then I go into this deep things about what's going on, why this and why that, and I show them a procedure, or let's go into this book and look at it. And sometimes you get some motivated people, and then sometimes they're like, just dude, just show me how to do this and let's move on, and you're taking too much time. I mean, which I can get that too. I mean, especially as working in a micro lab, it's very easily, but rarely it's an 8-hour day. It's 10 hours. You have to get through your cultures. Next shift doesn't have the training, so they cannot take after you. Maybe they can set up some Vitek or some things like that. So you're always looking at a very long day, so you want to maximize your time. But anyway, so what about how do you get into this, Nick?
Well, that is an interesting question. So probably like many, I guess my exposure to MLS as a field was indirect. It was not my first plan, if you will. My actual undergrad was actually in forensic science, and I was working actually in a crime lab, doing my internship. So my final semester, senior year, and I realized, wow, this is not at all what I thought it would be, and I cannot see myself doing this for my career. It was fascinating, but it was very rote. I did the same thing every day for 6 months, which was screening evidence for possible biological material or DNA. And then I would mark it, identify it, and it would go in a freezer until a DNA analyst could actually go and do the testing for DNA. So doing the extraction and then all of the additional testing that kind of goes downstream. So, and it was in a room very much like an 8x8 closet without a window. And I was like, I can't do this for 6 months, let alone think about doing this until there becomes a position opening up where I can become like a DNA analyst. And so, it's like a month before graduation, and I'm trying to figure out, what am I going to do? And I, of course, had a microbiology course. And I went to that one of the faculty who coincidentally happened to be a medical laboratory scientist herself. And she also was an adjunct faculty at Rush University where they had a graduate program. And I kind of debated whether or not I should stick around in my undergrad, which was St. Louis University, and do a second bachelor's degree, which would take another year. But she had kind of told me that there was a master's degree program, entry level in MLS. And if I wanted to, she thought I would be great at it. So I quickly applied. I came up. Over a weekend, I did like a tour of the campus over the summer, and I was like, this is awesome. It's exactly kind of what I wanted. Still very much science heavy, but I would admittedly be in a room much larger than an 8x8, and I would be working with people and not by myself. And so I basically, said yes, moved to Chicago and enrolled in that program. And that's kind of how I got into MLS. And for microbiology, it quickly became my favorite subject again, once we got into like the bugs, like from a clinical perspective, and learning all about the pathophysiology of the different disease manifestations they can cause. Learning about susceptibility testing and antimicrobial resistance was just perfect. And it really quickly became my passion. And I love micro, and it's why I pursued a PhD. It's why I became clinical microbiology laboratory director. It is just, I don't know, it's just so much fun. There's something new and exciting to learn about every day when it comes to these microorganisms. And I just can't picture myself doing anything else.
I definitely love it. Yes, it's and I agree with that. And I mentioned this before, but when I started prior to being an MLS, I was an MLT and going through that, and I wanted to find out what to do in civilian life, a job to carry it over. I like science, and I found this associates, and plus, they gave you money to re-enlist. So I'm like, okay, I'll do 3 more years, but taking those classes, it was just when I started seeing, and I don't know, it's anything from the visual. I love the color of the agar plates. Start with that simple thing. I love the colonies and learning about susceptibilities and then, like you said, there's so much to learn. It's just something that in one point in time, my goal was to get proficient at reading plates, and I did that. And I felt very good about myself. And then I went to my first conference out there, and hearing people speak, and talk about things, I realized how much I still needed to learn and how much I learned. If it was a language, I maybe spoke like 5% and I couldn't understand the other 95. And over the years, I'm learning more. But yes, it's exciting. And we'll talk more about this when I ask you about the other areas of the lab. Because that's something that, that excitement, it's what really I like working in micro versus other areas. I think, I was going to ask you, Christina, you talk about your first job in the field and you said, when you graduated, Nick, and you started your job in an evening shift, and that was just as a generalist or micro and doing a little bit of both?
A little bit of both.
So it was kind of like maybe like a smaller lab, so where everyone gets to do, I've been in that setting too, where sometimes maybe the people help with micro or either like plate setting, or if you get gram stains, like static gram stains, you read those, or blood culture. Was it something like that?
My first job was actually at Rush on their evening shift, and basically it's a consolidated clinical lab. So on second shift, everyone really, for the most part, were core lab employees. And, we went up to micro to do setups, to do rapid testing, rapid molecular testing, things like that. And yeah, gram stains, positive blood cultures. So that was my first clinical job. And then some days I'd be assigned to the core, down in the core lab. So I'd be doing, chemistry or hematology or something.
Okay, which brings my next question. And by now, both of you have touched, that you have experience other areas in the lab, and even to this day, and we'll talk about what you currently do in a little bit, but even you, Christina, right now, you teach things other than micro. So now, what are your thoughts? And I guess I'll start with this from what I have talked before and mentioned. I have worked in all the other areas of the lab. I started as a basically a smaller military lab where you had all the benches, and then you had micro too, smaller micro, but it had plate setting, AST testing and everything. And then that's why I want to be an MLS in micro, so I got my bachelor's and I want to do this full time. Well, life has taken me back it took me back to hematology, took me back to chemistry, and for me it's been okay. I don't know, and I mentioned this before. It seems that sometimes stress wise and maybe that balance with a nice shift and the hours and plenty of coverage and I compare the core lab with like maybe that a person that's good for you, right, has a good job, good feelings, treats you well, but micro is the true love and might not treat me so well sometimes, but that excitement I don't get it from other areas. It's just so I want to get your experience in other areas of the lab. As I mentioned, core lab you get good coverage and this nice turnaround thing. I found myself working from 6 to 30 like clockwork. 2 p.m. second shift comes in. You go over your pending log. You chat. Hey, this is pending. This is pending. 2:30, I'm clocking out. It doesn't happen in micro. So I'll start with this one. With you first, Nick, and then I'll move on to Christina. But what is I don't know what is your thoughts on other areas of the lab, your experiences versus working in microbiology?
I mean, I think it was really actually helpful for me, especially in my current role. So, one of the things that I enjoyed at the time, though it's been about 15 years since I've done one, was a differential. But occasionally I do get called to come down and look at something where they think that it, is this bacteria or is this like a blood parasite, for example. We've been seeing over the past couple of years increased numbers of cases of malaria. So I still get to do some of that blood parasite identification, which historically, at least in our laboratory, has been done by our hematology MLSs and our hematopathologists to confirm them. But admittedly, Chicago's not an area where a lot of malaria is seen, so it's nice to be able to kind of take a peek at those every now and again. So that's one thing that I still get to do a little bit, which is fun. Don't ask me to identify or count white cells because I probably couldn't do it and I'd mess it up. The chemistry knowledge I think is really helpful. And more so, it's not the chemistry knowledge, but it's the really getting familiar and comfortable around analyzers and equipment because there's so much automation and instrumentation in a chemistry or type of setting. Not that there's not instrumentation and automation in micro, but admittedly it's on a much smaller scale. So I think that's helpful for anyone, especially as the world is becoming more automated and more instrument heavy. Just being comfortable around those types of instruments. And I think that's an area where some more seasoned microbiology MLSs may not feel as comfortable because they're, other than like your AST equipment or your blood culture analyzer, there hasn't been a lot compared to some other areas. So I think that can be really beneficial. I would say those are the big things.
And before you go, Christina, and I that that you mentioned like the season, it feels like sometimes we have, and from my experience in the lab, like we have changed a lot, and I haven't been, as I always mention, I've been doing this long enough where I work cultures, with a Molotov and now we have it, but there's a lot of changes, and I'm like, for example, in my facility there's always it's constantly changing and it's a lot of things. So yeah, there's a lot of learning, from before, basically when we had just had Vitek and maybe do a few gradient strips and maybe on a Kirby panel. From now it's like, okay, well, this one, if you have this, you're doing broth microdilution. If you're doing this, you put it here, you do this. So we have a lot of things going on. So definitely a lot of changes. Okay, so what about you, Christina?
So I actually started in specimen processing when I started grad school, and then got recruited back to the microbiology lab in a second shift. position. In that lab, they had a consolidated, more centralized microbiology for about 4 different hospitals that came to that one lab. So there wasn't a whole lot of plate reading overflow onto second shift, but they did batch a lot of kit testing. They had a huge community outreach program as a nonprofit entity. And so most of the specimens that were coming into the lab came in on second shift. So a lot of gram staining, a lot of KOHs and setting up and kit testing and things like that. So that was great experience for me. And I worked day shift occasionally, but I didn't have my MLS yet. So they were like, you can plant, and then if we have time, you can come over and sit and watch. And they were probably annoyed by me, frankly, because I was like, hey, can I see what you got over there? You got anything cool? I want to go look at it. Can I help you? And then, unfortunately, the day shift plate reading positions, they didn't really have any when I graduated. And so, like I mentioned before, I went to work in a core lab type setting, more chemistry and immunology, although they did have a hematology department. But kind of like what Nick said, like, if you want me to do a diff, you are hard pressed to get that kind of help from me. I tell the students that all the time. I'm like, I'm here for you. For whatever you need, we'll get through it together. Like, even hematology, you're asking a lot, but we'll get through it together. So I think it's kind of funny that you mentioned that, Nick, because I guess maybe as something as microbiologists, we're like, about that. We don't do that, with the exception of the parasites. So, and then I made my way back to microbiology. And I do find in my experience that microbiology techs, at least the day shift one where you have plate reading, and like you said, Luis, how you got to stay on first shift because the skill mix is not there on the other shifts because that's not the bulk of their work. And so I do find that mostly the micro techs kind of stay in micro, and the blood bank techs, other like more manual areas of the lab, they tend to stay in blood bank. Even in the hospital that I worked in here in the Roanoke Valley, they were a smaller one as far as, the big university associated healthcare systems and whatnot. And so, I could shout to my blood bank friends across the lab, but for the most part, I stayed on my side, they stayed on their side. But I do, again, feel like those skills are highly transferable. And I do feel like having experience in other areas of the lab, because I trained as a generalist. I pretty much knew I wanted micro or blood bank, and kind of took the core lab job for experience right out of school. But I feel like it gives you a better appreciation too for the other areas of the lab and what those people are doing, and what kind of day and or problems they might be having at their end. And you guys can kind of like balance each other out, like, oh, they're like, oh, my QC like will not come in. I'm like, oh, I cannot make this Proteus. Leave my culture alone. Get away. It's a CNA plate. Stop that, Proteus. But I think it gives you a good appreciation of that. I do sort of wish I could be a little bit more well-rounded as far as my experience and my technical skills, and kind of bop over to other areas of the lab. But, there's not that many of us microbiologists. And so they're like, no, micro, you got to stay there, friend. So, and now I'm out of the lab entirely as of about a year ago. So I miss it a ton. That's my happy place. And so I love that. But I do enjoy getting to bring it to students too. And in our simulation lab, I tried to make things as realistic as possible for them, and also, encourage them to realize that even if micro is not your thing, you can gain an appreciation of the skills that it takes, of what happens, because part of our role in the overall healthcare team is to explain our knowledge and what happens in the lab to other members of the healthcare team. And so part of our role is education. And so I think knowing about each of the areas kind of perpetuates that, and also makes them feel important and like confident in their skills and in their position in the overall healthcare team. So I don't think I'd want to go back to anywhere else other than micro or blood bank, but we'll see, I guess.
Well, both of your answers, were definitely great, and yeah, no, I think just that's it is a wonderful profession, and you can choose so many areas, and everyone, they're so equally important, right? They require skill, right? Because you have to wherever you are, if you have to make sure that you properly identify that antibody, the blood type, that you properly write those cells, as you're doing that differential, that what you report is accurate. So it involves a lot of skill from all the areas, and right, so that's why you have a little something from everyone. And some people don't like the smell in micro, so they never want to go there. And
there's a smell in micro,
right? Yeah. What are they talking about? But yeah, and just like that, some people don't, and right in their career, some people maybe start as generalists, and then eventually at some point, okay, let me try now micro for a little bit. So that's a wonderful thing that we have different areas to choose from, and we can be well rounded. And it's definitely, it's a great job. But what you said, yes, definitely not that many people. A lot of times, I end up choosing micro, so we hurt a little bit for that. And as people retire, and that contributes to that they have been busy and things like that. It's just, but it's also good as an MLS if you graduate. Give yourself, because if you spend too much time in one area and you want to switch, it might be a little bit difficult to get a job too. So if you do micro for 15 years and then all of a sudden I want to go to hematology, well, there's probably 10 other candidates with rich experience in diff, so you might have a little bit of a hard time. So as you're young and just starting, it's definitely good to get some experience in all the areas. And maybe even if you do micro and you're able to have maybe like a little part-time doing core lab and keep up with your skills, that's also, it's also advisable and good. Okay, so now that we cover that, and both of you are not in the position that you currently start, right? So now you're doing something else within the field. And Nick, you talked about, maybe we can expand more a little bit on that. So you really like microbiology, and then so that's what led you there to pursue a PhD.
I was working, and I knew I wanted to go back to school. And I really, as corny as it sounds, I like learning. So I was like, well, I mean, getting a PhD is about as high as you can go. I didn't want to go to medical school to become a physician, a pathologist, or an ID doc. I love my pathologists. I love my ID docs. They're great. But that's not what I wanted to do. I wanted to kind of really stay in the lab. And if I wanted to be a laboratory director, I knew I needed a doctoral degree, to be able to, to sit for like a board certification. And so I did it. And it was like 7 long years of hard work. But it had its ups and downs, but it was definitely a lot of fun. Of course, I did my research related to clinical microbiology. I studied biocide resistance, so antiseptic solution chlorhexidine, which is commonly used to clean the skin of patients, particularly patients in an ICU setting, to remove surface bacteria. Chlorhexidine as a therapy has been shown to really reduce line and device associated infections. It helps to reduce bloodstream infections, bloodstream contaminants, and it's utilized quite, I would say, in outside of ICU settings as well. A lot of patients use it, or it's used on a lot of patients for various reasons. And I was really interested in exploring, if there's a lot of chlorhexidine use in a facility, in a certain patient population, could that potentially select or promote chlorhexidine resistance, which could make these antiseptics more difficult to use. And we were studying an intervention to control the spread of KPC-producing Enterobacterales in a long-term acute care hospital. And I was fortunate enough to get involved in this study with the principal investigator, who ended up becoming my dissertation advisor, Dr. Mary Hayden, who's now my boss and has been my boss for the last 8 years. and that became that became one component of my dissertation. And then also I got to, do something that probably not a lot of, clinical microbiologists do from a research standpoint, which was more of a, a qualitative, chart review and trying to develop a, essentially like a propensity score for patients who are colonized in the gastrointestinal tract with carbapenemase producing organisms, and to try to identify clinical factors that could predict that to determine who might benefit from some type of surveillance screening. And that was, like the last 4 years of my PhD program, which was all my dissertation research. And it really, again, just further cemented my love for clinical microbiology. And a lot of the things that I did in those in my dissertation research went on to kind of inform some of the things that I'm most interested about from a research perspective and things that I continue to investigate to this day.
So, like you said, you really like learning, and that's something because your particular job, especially I'm thinking as an introvert, like you probably, you get a lot of attention because you're the director. So I'm sure that people might come up with you, or you get phone calls, or people ask you, and so definitely, yeah, you really have to love learning and maybe not mind all the attention that it brings it. Is that something that you are just kind of like a follow up touching? I'll talk about introverts and things like that, but is that something that you're completely comfortable with?
Absolutely not. I wouldn't say I'm like a complete introvert, but I'm, I don't necessarily like a lot of attention, but it is something I have to be conscious about for the reasons you state that, people do call me and ask me things, clinicians, non-clinicians alike, and then having to be able to, come up with an explanation, offer alternatives, provide guidance when it comes to result interpretation, test selection, next steps, is really one of the hallmarks, I think, of a really good laboratory director in general, not just a micro lab director, but if you're a lab director in any discipline, you need to be able to communicate with the clinicians who are ordering your services and offer them your expert knowledge, because that's ultimately why we're there.
Okay, so now and Christina, you don't seem like an introvert from what I remember when I met you. So you're comfortable talking, and that's also a good thing from an educator, that you like talking at the same time. You like learning, you like sharing things, and there are some things that an educator, right, should have, and it takes patience and dedication, and sometimes you're gonna be explaining things over and over again, but definitely very satisfying when all those concepts click, and then you see your students, right, in my case, become coworkers and peers. You eventually see them and working side by side, so it's a very cool experience. So in your case, what what led you to become an educator?
So originally, like in high school, my goal was to be a biology teacher. And I was like, okay, maybe a biology teacher. And then people are like, you don't really make any money doing that. I was like, well, okay. So I kind of put it on the back burner for a while. And then when I was in my graduate program, I had colleagues and other students and stuff like that were like, I really like the way you explain that. Maybe you should contemplate teaching. And I was like, no, everybody's going to look at me. It's not an attention thing. I think there's a huge difference between being more on the extroverted side, which, yes, I would definitely describe myself in that way. But I was like, no, I don't think I can do that. And then, of course, after working for a while and gaining experience and whatnot, and when we would have new hires come into the lab, they're like, you really seem to like hanging out with the new hires. And I'm like, yeah, it's great. Like, I get to meet new people and we get to work on developing their skills, and they make a great amount of progress. Sometimes they say things and I'm like, dude, I didn't know that. It's been a while since I've been out of school, and that's amazing too. And so when the opportunity to adjunct for microbiology came up, I was like, I said to my husband, I was like, I don't know I don't know if this is right for me. And he said, you just got to try it out. And as an adjunct, you do it for 1 semester at a time. And if it's not the thing, then it's not the thing, and still working full time, doing what you love doing. So, and after 1 semester, I really fell in love with it. And I was really fortunate that my institution had a faculty line open miraculously. And so I got to move into that position, and we were a relatively small program as far as our student population and our faculty, and thankfully both have grown over the last 7 to 8 years that I've been here. It's kind of crazy to think it's been that long. And so I really do think it's the love of learning that Nick mentioned. I learned so much from the students. I hope, fingers crossed, that they learn a lot from me too. And I think it comes down to the enthusiasm and the passion that you convey for what you're talking about, even if they're not that into it. Even if, I told them too, we're not all meant to be microbiologists. And I totally get it. I'm not offended. Like, we got to do this. You're going to be generalists. You have to education this. But, I never thought that I would end up where I am in this position either. And so I'm really happy that I was able to do this. I love being in the classroom with our students. We are continuously looking for ways to make things more active learning. I know my colleague and I gave a presentation at CLEC a couple years ago, Clinical Laboratory Educators Conference, about the games that we play with our students in all areas of the curriculum. But no, I didn't think I would actually end up here, but I am, and I love it. And there's, again, transferable skills from everywhere. I do a little bit of management stuff. I do, obviously mostly education stuff. Sometimes some counseling, which I didn't intend for, but that all around. There's a lot of different hats that you have to wear in this type of position. And I think too, as a laboratory community, we don't really educate to get to positions that are not the bench tech. We just kind of grow without any type of direction or guidance into being educators, into being management, right? You're like, okay, well, this person, they've been here for a long time. They know what they're doing. Now you're the management. That doesn't necessarily give you the skills that you need to succeed in each of those positions. And so I know we have this a little bit later in our questions, but I would love to see more focus on professional development and in the role of educators and the role of management and administration, and even the dealing with people or communication, right? People don't like to answer the phone or make phone calls, right? Just text me, don't call me. So, there's a lot of skills I feel like you need that we could work towards developing. And I think it's definitely a doable situation. I think maybe that's why people don't envision themselves in an education position or in a management position or the infection control team or sales or field service engineers, all of those other options that exist out there, because either they've never experienced it themselves and not seen somebody doing it. Representation is huge, or they don't really realize that the skills that they're getting in their generalist education are transferable in that way. So I think it's definitely something that should be encouraged in the laboratory community.
That is great. And I like one thing, you mentioned, first you were talking about the texting, and that was, you mentioned the episode with Emily Mathis, and and they did that survey, and most people do prefer the texting, and they're not comfortable. And while you in the lab, you don't have direct contact with the patients, but you have to handle phone calls, and that's part of it. You have to call criticals too. You have less criticals than other areas of the lab, but you still have them. And at the same time, you have to deal with all sorts of your customers are the nurses, the physicians, asking, where's my culture? Why hasn't been, where is this at? Where are my results? I put a request for this. Why hasn't it been done? So yeah, that's something sometimes, I think I was doing like a Google search and I don't know, I'm not going to get into that, but it seems like nowadays you should text people before calling them, or like if just, especially with young people, I don't know, and you can comment on social media, or they'd rather, text, say, hey, can I call you, rather than just dialing the number and calling right away. So that's something that, and the other thing that you mentioned, like about not seeing yourself, you didn't see yourself where you are right now. And that's so true. Years ago, for me, that's just reading the plates. That was it for me. And I very happy. And and I shared this before, but I work in a very big lab, and they start you with urines, but they're a little bit easier to handle, less organisms. And then the pinnacle, the crown, it seemed that it was the wound culture, where you get like a lot of stuff, mixed infections, and so that was the price. But if you had asked me, 10 years ago, the biggest introvert in the Eastern Seaboard, that he was going to be doing a podcast, I would have said, you're lying. No. So even though I always liked, talking about what I do and stuff like that, but doing it in this scale, so yeah, you never know, where you're going to end up sometimes. So that's, it's been very rewarding for me. So now, as far as throughout your career, we always have good things. We have challenges, and I have mentioned this to someone before, but for me as an introvert, one challenge has been that I feel like I have to sell myself constantly because I'm so quiet. People don't know what I'm doing, who I am. So it's just always to the point that sometimes, it's draining. But on the plus side, I have learned so much doing this, opened so many doors and meeting wonderful people. And so I ask you, and I'll start with you, Nick, throughout your career, what are some things that you have enjoyed? And then on the other side, maybe any challenges that you have experienced?
There's a lot to look back on. I think one of the things that I've really enjoyed the most about my job, current job, has really been the people that I get the opportunity to work with. And I know it sounds cliche, but I spend a lot of time at work, probably close to about 60 hours a week. And if you're going to spend that much time in a place, hopefully it's with people you can enjoy and get along with, and that it's not miserable for anyone. So I feel that I've really been fortunate in that regard. And that extends both to all of the MLSs within the micro lab, but also across our broader department of pathology at Rush. Everyone in our department is just phenomenal, from lab techs all the way up to our pathologists and our faculty. Everyone is great. Everyone really wants to be, doing what they're doing. They're invested in their job. They're invested in their particular discipline, and ultimately, want to do well by their patients, and also want to, teach and engage and work with others. And I think that's, part of, working in an academic institution like Rush. And I'm also fortunate that outside of the lab and outside of the department, we have really great faculty with our, and interactions with our ID colleagues. And, if you could ask, I think, anyone outside of, the world of laboratory medicine, appreciates, what laboratorians bring to the table, I think hands down, it's an ID physician, because they recognize the inherent benefits of having, a laboratory, and technical staff, and experts who they can partner with. And I think that goes a long way. And I think, they are like, our champions to others within the medical community. In terms of what's been challenging, I think, again, I think of myself as being very lucky, and that I haven't had to face a lot of challenges. The challenges that I have faced, or the things that have been difficult, are really related to, I think, burnout in the profession. which makes it difficult for me to fill positions within our laboratory. And that directly impacts the staff that I have because they're, like you kind of said, they're having to work more, they're having to work longer hours to read through and get cultures done. And that's a challenge for them. And I think it definitely was exacerbated by the pandemic. And I don't think that's probably unique to clinical micro labs. I think that's not unique to pathology or laboratory medicine. It's pervasive everywhere. But I think that's really been the biggest challenge so far of my career has been the impact of the pandemic.
How about you, Christina?
I think that's my biggest challenge, or even not necessarily, definitely not mine alone, but as laboratory educators, is thinking about the workforce and it going forward. And I know the state of the national medical laboratory workforce when I started as an educator has not gotten better. It's gotten worse as time has gone on. And so our big challenge is looking for ways that we can increase visibility of the profession in general, of laboratory medicine in general. How can we be good advocates for our profession? Can we educate the community locally and further about laboratory medicine, about their bodies, about health, about germs in general? And I think the pandemic showed us that a lot of people around the world are not aware of how germs are spread and what their health is and how their bodies work and things like that. And so I think bringing awareness, I think the pandemic as a plus side, if you could even call it that, it did bring a fair amount of attention to laboratory medicine. And it's still a touchstone that when we go out to recruiting events or we do a lot of community events. We did one recently at an elementary school. I was trying to talk to kindergartners about what it is that we do, and to say, hey, have you ever been swabbed in your nose holes for COVID and stuff? Those things, they come to us in the clinical micro lab, and we're the ones who find out that you have COVID or the flu or strep throat or you're pregnant, diabetes, cancer, whatever. And so I feel like we're just acutely aware of the workforce shortages, and especially in microbiology. I know here in our local area, we've had some significant consolidation of microbiology labs within some of the local healthcare systems. One of our larger local healthcare systems decided to completely remove microbiology from their multiple hospitals in this area and move it to another part of the state. And so that's been hard from training students' perspective, and also, making sure that our community is served in the best way that it can be. So I'd say that's the big challenge, at least that I'm with right now and have noticed over the last several years, is bringing awareness to the profession, advocating for the profession with other healthcare providers as well, because we find that sometimes they also don't know exactly what it is that we do, and then trying to best support the workforce. As far as, exciting thing, I feel like this is cheesy, I'm sorry. I feel like every day is something exciting. If I can recognize that something that I have expressed to our students has gotten through to them, whether it is actual, skills and knowledge, or just oh, I can do this. A lot of times that's more of what it takes, is not that they don't understand the skills, not that they don't have the knowledge, them recognizing like, yes, I can do this. And I think that's really rewarding as an educator. And so it makes me be hopeful for the future. And so hopefully we can achieve all of these goals, make our challenges into opportunities going forward.
And as I mentioned before, when it's always great when you see the students and they say, hey, I can do this, and I found from my particular experience, teaching that, as micro, right? Sometimes, you get a lot of grade and gets that repetition that you get some students too that they're used to that everything works well for them, right? They follow a procedure, they do well in a class, and then they do their first gram stain, and then it comes out completely weird. And you see that frustration because it's like, okay, well, what am I doing? Like not being able to get it right away. But I train techs on the bench too, and when you see, right, that they have their own process and they're working by themselves and everything is clicking, it's so satisfying and rewarding. So definitely those are some things that we can improve, right? You mentioned the awareness of the profession, which I see that it has made great jumps over the years, and you see more people active, and as you say, going to schools but bringing that awareness, with that, it's gonna come that then we're gonna have to be prepared to be able in school to increase the size of the programs, right? Because right now, for mine, for example, we do one class at a time, so we have juniors, we have seniors, and that's about it. Maybe 30 students. So if more people come in, and not everyone that applies gets in, so that's another challenge. And I think anything else that you can think of that we can do to improve this field, Nick, whether it's the lab profession or microbiology or the field of microbiology.
I think not just focusing on microbiology, but laboratory medicine or medical laboratory science as a whole is like, if you want to see improvements in your profession, I think one of the things that's important for people to do is to join a professional society. Professional societies exist, most of them, or many of them exist to, bring recognition to a field, to promote causes that are important or, mission critical to that discipline or to that professional body. And I think that that's something that's really important. And I think, laboratory medicine, there's a lot of opportunities to get involved within a professional society. There's ASCP, ASCLS. For micro, there's ASM, of course. You can, blood bank has AABB. Chemistry has, well, it's not chemistry anymore, but ADLM, which I guess is supposed to be everyone. But there are all of these different professional organizations or societies. Advocacy needs to start somewhere. If you're passionate about a topic, look to see if any of the professional organizations are equally as passionate about that, because you'll find like-minded people there, most likely, and you'll be able to work on a cause together. So I think that is really critical for the laboratory community as a whole. If we want to see changes, if we want to see the profession continue to grow, and to see more people joining the field, then it needs to be more visible. It needs to be promoted. And you can do that as an individual, but you can also do that by joining a professional society who also feels the same way. So I think that's one thing that I would recommend anyone do, is to join a professional society. Because not only will you be able to do something that you're passionate about, related to your field, but it's a great networking opportunity to meet other people, to attend meetings or conferences, and look at what other people are doing from a science perspective, from an educational perspective, and to make those introductions.
Yes, and I completely agree with that, and that's why I recently in later years I started joining some, and I joined ASM, and I also joined ASCLS, and haven't been to one of the big meetings yet for the ASCLS, the jam, but I'm definitely been going to ASM twice in a row, and I enjoy it. It's just a great place to, once again, to learn more, meet people, and connect. And I think when it comes to the only thing, but I guess that's good for me, which is why when I created this podcast, it was that sometimes maybe, I don't know, it's the perception, but with ASM, a lot of times, and this is more like in content, with podcasts and things like that. It just, they're very tailored for people with like a higher level education, like PhD or so. A lot of times, I felt like a little outside of that because that's why I created, for so many reasons, but something where things can be a little more tailored because there's a huge workforce that are not, that don't have PhD, that we work on the bench and we deal with cultures. And so that's the one thing that I have noticed, but completely agree with the organization. And if you want to affect change, and I think maybe some things have improved, as I mentioned before, right? The awareness, without getting into it. Compensation, I remember that was another thing that for going to first shift, it was one thing that you had to look at. It's like you're gonna make less money because you're not gonna have that differential on the shifts, and so that was something at the turn. If you were like a single family income or single income, so if someone asks you for advice and whether to, I guess more to work in the lab, or what advice will you give someone looking for a career in the lab? And I'll start with you, Christina.
I mean, clearly, I love laboratory medicine, so I would wholeheartedly advocate for anybody who wants to pursue a career in laboratory medicine or healthcare in general, and hopefully kind of direct them to have a more holistic approach to medicine, as far as recognizing that patient care is a team effort. And so, there are many different ways to be part of that team that are not necessarily directly patient facing, if that's not what they want, and that we are a valuable part of the healthcare team, even if we are kind of hidden behind the scenes a little bit. But we try really hard to encourage others to go into laboratory medicine. I tell this our students, and even when we go speak at seminar classes for other life science degrees and stuff like that, or even high school, sometimes we do that too, is to explore your options. My program director is very fond of saying the only person who closes the door on you is you. And so I would really encourage people to look. And I will say too, I have a lot of students come in and they are jazzed about micro, and they're like, micro is my thing. I got my undergraduate degree in microbiology. I am ready. I'm like, okay, that's cool, but look at what else is out there too. See if you like something else. I didn't expect to like certain things. We've already discussed that no one wants me doing the hematology. But I love hemostasis. Hemostasis is amazing. Coagulation is amazing. Your body is the coolest ever. And it's not something that I ever would have expected to love or enjoy. The same with blood banking and, thinking about all that antigen-antibody interaction. We use that a ton in micro too. So make sure that you're exploring all of your available options. Look outside maybe of your predefined, pretty narrow comfort zone, and, take that chance. You might like something different. An opportunity might come up to go somewhere else and do something else. And also look for people who are going to help support you into getting to whatever that goal is. So, again, embracing learning. You're going to continuously learn. Sometimes even if you don't want to, you're going to learn something. And so there's opportunity everywhere, especially in laboratory medicine. We can help get you wherever it is you need or want to go. And just be open to the possibilities, the meeting new people, the joining of the professional societies. I know I did a little light stalking on Luis and reached out to him to come when I was planning our ASCLS Virginia meeting, and reached out to him, and I was like, hey, I know that you are far away geographically, but would you be interested in coming and being a speaker at our state society meeting for ASCLS? And he graciously agreed, and now here we are. So a podcast is not anywhere that I thought that I would be. So again, just say yes to available opportunities, and don't close any doors on yourself. Be open to possibilities.
Well said, and and thank you. I had a great time, and I enjoyed my experience over there. So it was very nice and a good time. Um, I love blood bank too, and if I couldn't do anything microbiology related, I will be in the lab doing blood bank because I always enjoy it too, and maybe it's that whole thing right from the mystery, which is like kind of like with micro finding out what we have, and I don't know. I really enjoy that. So how about you, Nick? If someone asks for some advice, or what will you tell them?
I mean, I think Stina really did a great job answering that question. I think the one thing I might add to that though is I always try to recommend people to if there's an opportunity to shadow in a laboratory or and ideally shadow like multiple areas, you're never gonna get a full sense in a single day. And I tell people that up front, but get some exposure to different things. I think that's really critical. You can learn a lot by reading, by studying, what a program has on their website and so forth. But you know, if you really want to see a day in the life, try to arrange that if possible. And I think there's a lot of people who would be willing to help other people do that. And I think that that's just one thing that I would recommend and add into kind of other things that the other things that Christina had mentioned is, yeah, try to arrange for some shadowing with a couple of people, or a couple of different areas to really kind of get a sense of, yeah, I could see myself doing this, or be like, oh, no, I don't think so. But, maybe it sparks a conversation that you have with someone who you are shadowing with, to go in a different direction.
Well said. Like this has been wow so great, and I have really enjoyed talking to you both, and I appreciate the time. We have been talking for a while, but of course, as microbiologists, I have to ask you this because we all have that one bug, right? Whether it could be something, like a mechanism from or anything, like visual, or for any reason we tend to have an organism that we like the most. So I'm going to start with you, Christina. What is your favorite bug?
So I was thinking about this. I saw this on you. I know you like to ask people this too. So I was thinking about this. Honestly, I don't know if I have I know I have at least one that I do not like. Does that count? I do not like a Proteus. Stinky, doesn't smell like chocolate. Absolutely not. No thank you on the Proteus. But I mean, I guess at the risk of sounding extremely basic, I really like Pseudomonas aeruginosa. It makes those beautiful, flat, metallic, iridescent, I tell my students, mermaid scale looking colonies. So, and it has a pleasant, for the things we're not supposed to sniff, of course, has a pleasant odor to it, which I don't notice these bad odors unless it's Proteus, but a pleasant odor is nice to have every now and again in the micro lab. So I guess at the risk of sounding basic, I'm going to go with Pseudomonas aeruginosa.
Now, are you...
Go
ahead, Nick.
No, I was going to ask Christina, is your pleasant odor the grape chips or grapes or the corn tortilla chips?
So I'm definitely a grape Jolly Rancher kind of girl. And I give those the day that we do our Pseudomonas lecture, I give my students grape Jolly Ranchers. But the other description, I participated years ago as a counselor in like a healthcare camp where they would go shadow different areas of the hospital, and they came to the lab and whatnot. And a child, middle schooler, described it to me as new shoes. When you get like new like leather sneakers and you open the box and like that smell of new shoes. And I was like, you are right. I never thought about it that way before. I don't feel the corn tortillas. I have heard people say that. I'm going grape Jolly Rancher all day. But new shoes is something.
Maybe I'm going to have to go buy a new pair of shoes to see if I
there
get
you
this
go.
smell.
I support this, Nick.
I love that you said the grape because I don't get the tortilla chips, and so that's pretty cool. So but yeah, I do get and I tell this to students going to the Pseudomonas. I had a tech on the lines of the new shoes. Like she said that it smells like a Payless shoe store.
See?
Yeah, that's what she said. And then sometimes, I tell this to the students, and some they nod and like, oh yeah, I get that. And like, yeah, that's right. So, but definitely with you open that incubator and with that myroides or that alkaligenous hits you, it's just, I remember, it gets you excited. It's like, I have something different today. You're like seeing E. coli all day and Staph aureus, but here
Yes.
I have something good in those plates. So it gets, the nerds, it gets us excited that
It does.
yeah. So, I want to ask you about yours, Nick. But I don't know. Are you on the tortilla chips team or the grape?
Oh, no, Team Grape all the way.
Ah, nice. All right.
Woo-hoo.
So, what about you? What's your favorite bug?
So I'll say mine's actually a fungus. I love mycology. I think it's just amazing. And favorite bug right now is probably Malbranchia. Just because I like that it's a little bit of a mimic sometimes, maybe it could be a coccidioides from that microscopic morphology, but not always. But yeah, I like Malbranchia, kind of like a little chameleon-y to me.
That's a dicey game to play. Are we coccidioides? I don't know.
Wow, I love it. That's definitely I asked this before, and I think probably that's the best or most unique answer that I have gotten from that question. Well, before we close the episode, is there anything else that either of you want to talk about or tell the audience? I'll start with you, Christina.
I just want to say laboratory medicine is amazing. And if you enjoy solving puzzles, if you want a healthcare career where you get to help people, but necessarily don't want to be patient facing, or again, solving mysteries is your thing, I think the clinical lab could be for you. And we are not all introverted folks. That's something I tell. At one point in time, myself, my program director, and an adjunct that we had, we were all very extroverted human beings. And I think it made some of the students a little afeared. And so there's a place for everybody.
100% everything Christina said. Though again, micro's the best. Just have to put that out there. Micro's the best. So, yeah, no, I've really had a lot of fun. Thank you so much for the invitation. This has been a nice afternoon.
My pleasure, and it was great. I think I was always trying to think, especially when I meet people, and I'm like, okay, they will make a good guest on the podcast, and and sometimes it takes a while finding the right topic, but I was it's so great that I was finally able to talk to you through here. So thank you for taking the time, and as as you mentioned, yes, not everyone's extrovert, so you have all different personalities, and the one advice for the introverts is just you have to get out of that shell and let yourself known. If if you want to do well in your career and bring things to the table, but sometimes I know it's hard, but it's there. I was definitely terrified the first day that I was gonna teach on my way in the car, but then I did it and it went away, and I still struggle with a lot of this, but anyway, what a pleasure. So thank you both for taking the time to be in Let's Talk Micro.
Thank you. Yeah.
Thank you so much for having us.
My pleasure. And that, my dear audience, it's the end of this episode. I hope you enjoyed listening to this great conversation with Christina Angelini and Nicholas Moore. As always, I enjoy sharing this information with you. It was such a refreshing episode to talk about careers and how did they get there. They both started as medical lab scientists, and then Nick became a director, Christina's an educator. So many things that can be done. So I hope this is inspiring, and maybe you're thinking about switching careers within the field. So I enjoyed it, and I plan on doing more. So please continue bringing that passion to what you do. It is so important. You do such great work. And of course, stay tuned. Great things coming your way. So, as always, stay motivated, stay safe, and of course, continue talking micro. Until the next time. Bye.